Hi, I'm Taylor-Penn, Senior Policy Analyst with Families USA.
And I'm Amber Hewitt, Director of Health Equity at Families USA. And thanks for watching our video series on the top 3 priorities for combating the COVID-19 pandemic. And in this video, Lee and I will spend a few minutes talking about the role of health equity and how an equity lens is critical if we want to flatten the curve or slow down the spread of the virus. And at Families USA, we envision a nation where no one faces barriers to a healthy life based on who they are or where they live. And we have a lot more work to do for that vision to become a reality. In fact, the primary reason why we have the highest rate of COVID-19 infections and deaths in the world is because of our extraordinary rate of COVID-19 infections and deaths in communities of color. I was reading an article yesterday about Navajo Nation. So communities of color, be it Navajo Nation to New York City. So in this video, we'll spend a few minutes discussing solutions that Congress should consider in order to reduce these stark disparities in COVID-19 health outcomes. So why don't we jump right into testing and contact tracing. The effectiveness of our testing and contact tracing strategies is essential in slowing the spread of the virus. And this also means prioritizing testing and resources in communities hardest hit by the virus. Lee, what are your thoughts on that? Would you agree?
Absolutely. In low-income minority communities, physical distancing can often be difficult because people of color are more likely to live in multi-unit dwellings like apartment buildings or in intergenerational households, and they're more likely to serve as essential workers. Those folks who are going into work every day and may be putting their family members at risk when they come home at night. So it's really important that we're prioritizing testing in these communities that are hardest hit. And this means having interpreter services at testing sites, having walk-up in addition to drive-up sites, and making sure that there are no photo ID requirements, which can limit access for elderly, low-income people or for immigrant populations.
Thanks, Lee. And that has me thinking about the role of community health workers. Here at Families USA, we've advocated a lot for really valuing more this critical healthcare workforce. And community health workers serve as a bridge between communities and the healthcare system. And when we talk about testing and contact tracing, I think about, what happens after testing and making sure that we have equitable access to COVID-19 treatment and related treatment such as mental health. Again, I'm a psychologist by training, so we're seeing a high increase in anxiety, mental health needs, oral health needs, and this impacts many of our immigrant populations, the newly insured and frontline workers. So Lee, can you spend a few minutes talking about some policy solutions that would address equitable access to COVID-19 treatment?
Yeah, there are a lot of ways that policymakers can fill the coverage gaps that you're mentioning. So a few of these are, first of all, they could lift the 5-year waiting period for Medicaid and CHIP eligibility for lawfully residing immigrants. They could restore Medicaid eligibility for compact and free association migrants, also known as COFA communities, and they could extend Medicaid coverage for 1 year postpartum for women made eligible for Medicaid at 100% FMAP through the duration of this crisis. And there are many more policy solutions and paths that they could take to closing up these gaps.
Right. And as we know, access to healthcare through insurance coverage is a key determinant of health. And I was doing some reading a little bit before this video, and I think it's important to mention that the optional state Medicaid eligibility group that was in the Families First Act does not provide COVID-19 testing for immigrants who are ineligible for federal non-emergency Medicaid. And Lee, I know you have a public health background, and in order for us to have effective strategies, that is not, that's not a robust strategy. We're leaving out large segments of our population. So in our last few minutes, we'll discuss state fiscal relief. And this is important because we're not only facing a health crisis, but an economic crisis. And Congress has passed several pieces of legislation around relief, but the federal government needs to do more to help states manage their Medicaid programs. And also, this additional relief would allow states to have, more flexibility to be innovative in their health equity approaches. So, Lee, what have you been hearing on this?
I have been hearing that governors are already cutting their budgets and they are making plans to continue cutting their budgets into this next fiscal year due to COVID-19 related budget shortfalls. They're making cuts across the board and in really important social services that impact quality of life and reduce health inequities. So, for example, they're planning to cut Medicaid coverage, which is something that you mentioned, child welfare services, services for homeless populations, mental health services, and much more. So it is so critical that states get the support that they need right now in order to be able to provide services for those who need it most.
For more information, we would also refer you to one of our papers outlining 5 strategies that states are using to combat the COVID-19 crisis. So as we conclude, putting these 3 priorities in context, so testing and contact tracing, coverage, and state fiscal relief, putting these in the context of health equity, we need a wider lens on the impact of COVID-19. So this means upstream determinants that address the root causes of health inequities and downstream determinants that impact and address equitable access to COVID-19 testing and treatment.
Amber, thank you so much for leading us in this important conversation on integrating health equity into a COVID-19 response. I'm Lee Taylor-Penn.
And I'm Amber Hewitt. Thanks for watching.